good afternoon, and back to see you again. This week it's me live from home for the 1 p.m. news, and we're going to give you the update on the COVID-19 situation in Thailand. First of all, if you haven't checked any international news, this morning we wake up with the news that Myanmar leaders and high-ranking officials Aung San Suu Kyi and another several people has been detained by the military. And only a couple hours later, the military actually went on national TV live and announced that they officially making the coup d'etat and they declared a state of emergency for Myanmar for a year. So that is the latest news of what is going on in Myanmar, neighboring country. But now let's get to it. Today we are going to talk about the latest number of new COVID-19 cases that has been discovered in the past 24 hours. Today is the first day of the relaxation of the strict guideline of COVID-19, especially in Bangkok. We are going to talk about what will be allowed, what will not in some certain business types of business. And we are going to talk about the central shrimp market in Samut Sakhon, which is the center of the current outbreak. And what are they doing now? What is the concern of authority? One of the Thai PBS Thai language reporters has been on the ground in the area and walk around with the health official of Samut Sakhon. And we'll see what is their concern and what will be the new normal that everyone has to adhere to and what is the chance. And then we are going to talk about the poll by Dusit poll that said over 80% of Thais worry about COVID-19 vaccine side effects, but most want to be inoculated. Okay, so let's start with the first news today. The first news today is from the press briefing of the Center of COVID-19 Situation Administration or CCSA. Today is Dr. Apisamai. Is the one that made the press conference. Here is Dr. Apisamai. Okay. And so the number today is 836 new COVID-19 cases with 4 import cases from United States, Belgium, United Kingdom, and Malaysia. And there are currently 7,027 people receiving treatment, 11 of whom are in critical conditions. But first, before she gave us the numbers, she was talking about this is the first week of February, the proactive screening will still be as intense as it was in the last couple of weeks. So we will see still a big number of new cases, but hopefully it will start falling down pretty soon. And she said if the trend goes as expected, as the way it is, it looks stabilized, it looks like it's coming down, the country will see more relaxation in the second week of February, which is next week. So we're going to know more on Monday probably, or maybe just the day before how it's going. So regarding the situation in Samut Sakhon, the rising number of the new cases in the past few days, because there were proactive screening in the deep red zone, they actually call it egg yolk zone, which is the Tha Sai and Klong Madua sub-district, 2 sub-districts. And they said that these are the concern area because there are several factories with more than 10,000 employees in there. So you can imagine it's a lot of people working in the same place, very difficult to do social distancing. And if they have been working together, some of them live at the same place, there's a chance is that the outbreak will be pretty bad. It's spread pretty quickly. And she said the most important measure is to create a bubble around this deep red zone area. If they find a place to be a hotspot for the outbreak, they try to build what they call the bubble, which is the infected will be confined in the area And they said that all this sub-district and the area with the factory is not just factories. They're usually like some retail shops, some markets, some sport fields, some basketball field, or some football field, just to give us an idea that they actually a little community when everything inside is not like they just have to be in a room without nothing else or be in a factory without nothing else. But she said that a security official on the movement restriction remains very strict around all this deep red zone area of Samut Sakhar. As for Bangkok, we see numbers the past couple of days. It's a little on the high side for the Bangkok because they have been proactive screening in several districts, and they have screened over 10,000 people already. And right now, there are 45 people found to be infected from all those proactive screening. So if you count in percentage, it's fairly low. It's lower than 1%. So according to her, it's a good sign. CCSA Deputy Spokesperson Dr. Pisamai Sirangsan said that Bangkok's figure shows that the outbreak situation is under control. Now, the focus today is from Ratburi and Mahasarakham. It is a big cluster. It's all related. There are 2 new cases in Ratburi, which the person get infected in Mahasarakham. The patient 0 of Mahasarakham of this new cluster actually get infected in Bangkok. And I'm not sure he or she, because she didn't say whether it's he or she, this person traveled back to Mahasarakham hometown after being in Bangkok, but on the way stopped by at Nakhon Ratchasima, or Thai people call Korat. And in turns, because stopping by there, that's why the official thing that he got infected from Bangkok, because when he or she stopped by at the Nakhon Si Thammarat, family members got infected. Another 7 or 8 people got infected. Let me see, 8 people in Nakhon Ratchasima got infected. And then this person traveled with the private car, go to Mahasarakham, and had quite active social activities. Have been numerous Thai people call Tok Share, which is something that you put money together and you take turn use that lump sum of money and give out interest. It's a kind of activity that people do in Thailand as also a social gathering. But this person has been doing several of that. So because of that, it's putting over 100 people at risk of getting infected from this one person. But right now, the number is at 16 in Mahasarakham and 8 in Nakhon Ratchasima and 2 in Ratburi from one cluster. So that was the focus at the press briefing today. Let me count. So 16 and 2 is 18 and another 8. So total right now from this cluster only is 26. It's not that far behind from Bangkok cluster from the birthday party of DJ Patum. Now, there are 14 provinces that have not recorded any COVID-19 cases, which is still good news. While there are 42 provinces that have not recorded any new cases in the past 7 days, that is also a very good news. It means they are doing something right. The spokesperson said that CSA understand that all these eatery operators are experiencing hardship because they're not allowed the alcohol to be served in the restaurant, and they shorten the hours of the services. It's very difficult for a lot of business to keep things going for the current disease control measures. So she said that she wants all these business owners to help propose the measures, what they think would work, how would they enforce the hygiene measures, the guidelines, to make sure that the customer will adhere to the COVID-19 guidelines by CCSA. So it's like pitching the idea and see whether CCSA can work with that. And if it's something from the business over themselves, this is my opinion, you probably see something that the CCSA doesn't see, or you probably have an angle that CCSA didn't think about. So maybe you can come up with something a little more effective for your business and also effective in terms of keeping hygiene measure very strictly. So Dr. Pisai asked the public to follow the information very closely, especially on the restriction of each area, because there's like deep red zone, yellow, there's green zone. All of them have all different restriction in terms of activities and the limitation of movements, the hours of business, things like that. So she also talked about markets, like the fresh markets and all these promises to be very strict on hygiene measures for the vendors and the visitors, the cleanliness of the venues, and enforcing the guideline. So Thailand, she said, cannot reduce the number of new cases to zero yet. What Thailand needs to find is to find the infected as early as possible and proper timeline information of each cases. That's why they always stress on not concealing the timeline information. Very important, so the official can trace the contact and know how many people actually at risk when we talk about each cluster. Now, we're going to talk about the Bangkok relaxation of COVID-19 measure that's starting today. If you go to the BMA spokesperson Facebook page, you will see that there will be you will see that there will be some suggestions, some questions, some answer that the spokesperson thinks that Bangkok might need. So we are going to go to that page, and I have some summary for you. Important question about the Bangkok business operator. First one is how late dine-in service at the restaurant can be. It was 9 p.m., but now the customer can dine in at the restaurant from 6 a.m. to 11 p.m. Outside that hours, you can buy food and take it home. The alcoholic drinks are allowed to be sold, but not allowed to drink on site. So all this business still can sell the alcoholic drink that they have, but cannot have customers sit there and enjoy the alcoholic drink at their restaurant or their food joint. And next question, can a swimming pool open? The answer is yes, with a strict disease control measures. And I believe the CCSA or BMA already in contact with all this business operator. And now we're going to talk about the football field. The football field that with not real grass, with the imitate grass, they can hold a tournament, but with strict disease control measures and no spectators allowed. No cheering crowd, no watcher on the stadium. It's only 2 teams and referees and coach and all that stuff that needed, but no spectators. And the next question is, can boxing rings hold a tournament? Yes, it's allowed to open, but it has to be with strict disease control measures, and it can hold a tournament, but no spectators allowed also. And when we talk about playground, we talk about inflatable castles. If you have children, you know what I'm talking about. They talk about ball pits, all these things, whether it can be open for children yet. The answer is no, it is not allowed to open yet. And also another business that allowed to open for customer is billiard and snooker clubs. It is allowed to open, but it has to be very strict in terms of disease control measures. Another question is, can restaurant hold a live music performance? The live music performance is allowed, but no dancing. No dancing whatsoever. At first, I was going to say no dance floor, but then if you stand at your table and dance, it's probably not allowed as well. So no dancing. You can listen to the music and enjoy it, maybe, move on your chair, but no dancing. And can banquet venues hold events? Yes, if no more than 100 participants without alcoholic drinks, and also no dancing. So if you want to hold a wedding, you already plan it out and it's small enough, like 100 guests, you can have it. It can happen, but no alcoholic drinks and no dancing. Now, other type of business that has been opening all this time hasn't been closed yet whatsoever. They still have some strict measures they have to follow. They have to keep temperature screening. They have to facilitate social distancing at least 1 meter apart for their customers from each other. They have to provide hand sanitizing or a place that their customer can wash their hands with soap and water. And all surfaces has to be cleaned before the activities. They said during the activities, I don't know how that's going to happen, but before and after, it's something possible. And participants or your customers has to register or write down their name when they get inside the venue, or use a tracing application, especially Thai Chana, when they get in your venue or your business and then come out. So that is something that CCSA is asking all business operator to do. But if you have something else that you would like to propose to CCSA, they are willing to do so. They have their hotline. You can give them a call. They want to hear from all this business operator. If you have any better suggestion that will keep your business afloat, but also still enable your customers to adhere to the strict health, hygiene, public health, disease control guideline. Now, we talk about Samut Sakhon as the center of the new outbreak. We talk about it, we call it as the Shrimp Central Market, and also in Mahachai Market. And in the area, there are some dormitory buildings that a lot of migrant workers has been living. And in some room, there's like 3 people. In some room, there's like 6 people, 2 families together. So there is a question of how this new normal will be able to happen with this strict guideline. So what you see now on the screen is the Thai PBS reporter that she was on the back of the truck, of course, but she was talking to the health official of Samut Sakhon and take her around the area and talk about the challenge, what's going to happen, what can be the new normal. Let me put my face smaller so you can see here what's it look like now. If you have been there before, you would know that this is already a more organized version of the area. The Central Shrimp Market in Mahachai district of Samut Sakhon province is, the epicenter of the latest COVID-19 outbreak. The event stresses the unspoken issues of crowded living spaces and quality of life of all these migrant workers, a lot of them illegal. So these journalists of Thai PBS, Pataraporn Tangam, had opportunities to talk to several key officials in the area to discuss this issue. One of them is the nurse at Ban Kampra Hospital in Mueang District, Kitti Ruang Vilaiporn. This is the first one that you will see on the screen with the white gown, this guy, Kitti Ruang Vilaiporn. He said that the priority is to keep the area clean, which will lead to the better quality of life. The residences have been cooperative since this outbreak happened, especially about the garbage management, and keep their living space clean and tidier than it was before. He said the challenge is that there are 3 to 6 people in each room. So you can see it's very crowded. It's not a big room. It's very difficult to enforce social distancing. So the new normal everyone has to adhere is important, that it is the personal hygiene and the residence cleanliness. Of course, it's very difficult to enforce social distancing. So have to make sure everybody try to stay clean, wash their hands as often as possible, and wear their mask at all times. Another person that the journalist has been talking to is Dr. Naredit Katasima. He is the the doctor, provincial doctor of the province, not this one. Let me see. Let me see if I can find him for you. This guy, let me wait. This guy is one of the migrant workers in Samut Sakhon that she has been talking with. He said that he know that the problem before is when you talk about the outbreak, his colleagues didn't realize that how necessary is washing hands, wearing masks. And he said right now everybody realized that how important this is, how important to contain the outbreak, because when the outbreak happened, lots of them is out of work. So they all know now how important it is. Now, we gonna go to another person. This is the public health officials, Dr. Naredrit Kattasima. He was talking about the challenge, the most important issues needed to be discussed is how the living condition of migrant workers in Samut Sakhon should be like, and how can they do to improve it. If they are still crammed up together like there was before in the dormitory like condition, the chance to have more outbreak is still high. So he also stressed on the issue of personal hygiene that has to be changed from what it was. So that is what's happening in Samut Sakhon, especially in the epicenter of the outbreak at the Central Shrimp Market in Mahachai Market. So right now you can see there's no activities going on, that people still live there. So they're trying to make sure that after this, there has to be some certain things they can do to keep the health measures going to make sure the outbreak doesn't happen again. Now, let's talk about the poll. We have been giving you updates about the vaccine so many times. And we know a lot of people have interest in it. Right now in Thailand, there has been a discussion about AstraZeneca from the United Kingdom, and also Sinovac from China. And there is some vaccine in the pipeline that Chulalongkorn University is entering the new phase of human experiment in next month or two. So at least by the end of the year, Thailand plan to have half the population inoculated. The plan is not officially out yet, but we know that according to the official, this month, February, we should have a number of vaccines to give out to high-risk health personnel in Thailand, 200,000. And then the following months we'll have more. By May, we should have about 26 million doses. And by the end of the year, 60 million doses, which is for half of the population. Anyway, so Suandusit University try to talk to people and see how most people feel. It's a poll of 1,570 participants, and more than 80% of Thai respondents to that poll said that they are worried about the potential side effects of COVID-19 vaccines. But over 65% still want to be inoculated once any side effects are known. So information is good. If you know in advance what's going to happen to your body if you get vaccination. Sonasit Poll conducted this questionnaire during January 22nd to January 29th, so about 7 days, about the opinion that related to vaccines in Thailand. The poll also shows that 88% of correspondents 88% of respondents are confident that after inoculation, they will be protected against the virus. 83% say that they still need to take precautions after inoculation, and 20% say that they have heard of the Pfizer BioNTech vaccine, while 52.55% said they know of the AstraZeneca version. So I believe AstraZeneca is something that Thai people should be more familiar with because it has been in the news in Thailand more often. It's also the technology that the Thai company, Siam Bioscience, get a contract of the technology transfer. So the company should be able to produce the vaccine in Thailand ourselves. And it's part of our government that may be in the future able to send vaccine out to our neighboring country. But at first, we have to take care of ourselves first, right? So Dr. Witthawat Ratana Thawan, of the Science and Technology Faculty of Somerset University, said that the opinion poll results show the majority of Thais are interested in and keep themselves updated about information on COVID-19 vaccines, which is a good thing, and such as their price, efficacy, and side effects. And Dr. Witthawat said that it is the responsibility of relevant agencies to explain to the public the efficacy and safety of each of the vaccines produced by the various pharmaceutical firms. So if you have been following news, Sinovac has about 50% efficacy, but the experts say that after combined with the experiment in Indonesia and Brazil, I think it's Brazil, the efficacy should go up. AstraZeneca have over 70% efficacy, but when you try in a large number of people, the efficacy rate might come down. But remember, the virus, the flu shot, the efficacy is only 50%. So 50% is like a threshold that a lot of countries accepted around the world, not by the WHO standard for the COVID-19, but still a standard that a lot of countries accepted. But anything at all, right now, there's a lot of companies trying to compete or race to the finish line to get the vaccine now. And you can see there's a lot of countries around the world got start their inoculation plan or project or program campaign already. For Thailand going to happen soon. And the prime minister promised that Thai people, he used this word, it's not going to be a guinea pig, and he will make sure that it's safe before he let Thai people have the vaccine. So I don't know what's going to happen, but it'll happen very soon. We have to get inoculated somehow. And that's all the news about COVID-19 situation in Thailand for today. We'll see you again at 7 p.m. with Nat Bunnak and me. I'll be live from home. Nat Bunnak will be live from the studio at Thai PBS World. And we will bring you the latest update on COVID-19 situation in Thailand. But for anything else, including COVID-19 news, you can follow us on our website. Let me show you. We have, let me take this banner out. There you go. We have Facebook, which we do live at 7 p.m. today, and we're doing live at 1 p.m. every day now for COVID-19 updates. And we have website thaipbsworld.com that beside the COVID-19 news, you have politics news, you have food and travel, and many other things that happen in Thailand, also in ASEAN country. We have in-depth analysis. We interview some experts. We have some exclusive pieces, a lot of interesting things. I'm not exaggerating it. Just good stuff on thaipbsworld.com. We have our YouTube channel. Every video you see on our TV show or on our Facebook Live, you will also be able to see it playback on YouTube channel, Thai PBS World. And we have Twitter, which is quite active. Sometimes we tweet something or some information or some photos on Twitter that we didn't post it on other social media that we have, just because the platform works differently. So whatever platform you feel comfortable with, Twitter, YouTube, we have Instagram too, or Facebook, or our website. Just get on it and check out. There's a lot of interesting things. And that's all the news I have for you in this edition of Thai PBS World News Update. And see you again tonight at 7 p.m. สวัสดีค่ะ